The topic of genital autonomy is discussed in all Nordic countries on different levels, in different contexts, but not necessarily so often from a bioethical perspective. We have collected the questions you have entered in advance and handed them over to Brian Earp, who will address them. The stream has a live chat, and there might be a chance to address comments from there during the session as well. In addition to that, the discussion may also continue afterwards in the discussion field of the Facebook page mentioned in the live chat. With this introduction, I will be glad to hand over to the bioethicist, the interdisciplinary researcher, Brian Earp. Varsågod, Brian.
Okay. Hi, everybody. Thanks for suggesting that we do this. And I saw the questions that were submitted earlier, so I'll start with those. This is a topic that I've been researching and publishing on for almost a decade. And so I have a tendency to go off into different digressions. And as a way of disciplining myself, I've written down some notes for how I might briefly respond to each of the questions. And I'll start with those. And then I might add some side thoughts, and also we'll have time for questions and follow up afterwards. So the first question that I looked at was one that just asked about terminology. And this is an important starting place, I guess, because I'll be referring to various practices throughout this live stream. And so clarifying why I use certain language is probably a good place to start. So this question says, what should the procedure or these procedures be called? Circumcision or genital cutting or genital mutilation? What is it that decides what term should be used in a given case? Is it the sex of the person that's affected? Is it the specific type of procedure? Is it the cultural context or something else? So this is an enormous, complicated and very, very politicized question, but I'm going to simplify as much as possible and just tell you what my perspective is. So generally speaking, I think it should be up to each person to decide whether they view their own body as mutilated or disfigured, especially as this can be very bad for a person's body image and self-esteem, and it can affect their ability to have positive sexual relationships. And to take what in somebody's culture or community is considered normal or even aesthetically preferable, and suddenly to tell them that their personal anatomy is ugly and damaged and disfigured is something that's certainly not a neutral act. It's not merely a scientific description or something like that. The reason why I say that is that the term mutilation specifically signals a change to the body that the speaker regards as bad. And you can see this by considering the example of cosmetic labiaplasty, which is trimming of the labia of the vulva, which is a common procedure in Western countries. So I'll start with this just to get our intuitions oriented around a practice that's maybe more culturally familiar. So to use the definition of the World Health Organization, what they refer to as female genital mutilation, they've defined as simply any cutting of healthy female genital tissue that's not medically necessary. That's their definition. So on this definition, labiaplasty, which is done for cosmetic reasons as opposed to a strictly physical or functional reason, is technically mutilation, female genital mutilation on their view. Now, the World Health Organization doesn't treat it that way. International human rights law doesn't treat it that way. So immediately you have a sense that there's something a little bit more complicated going on than the typical picture. So why do we not refer to labiaplasty as labial mutilation, even though that's what we should call it if we're taking the WHO definition seriously? I think we don't do this because most people recognize that the women who have this procedure done regard the change as an improvement to their body, even if it's based on problematic norms that cause women to feel uncomfortable with their body as it is. That's very well the case and is an important consideration. But nevertheless, all things considered, we accept that from the perspective of the person who chooses this procedure, they regard it as an improvement to their body, not as something that disfigures them. So here, I think we are able to assume that because the woman consents to the procedure. And so the consent here is used as a proxy for a positive attitude. The idea is, because she consented, she must see this as a good thing. She must see this as a change that she prefers. But I think consent is really just a proxy here, because it's of course possible to see a change to your body that was not chosen as an improvement, especially if you've been culturally conditioned to see the change as normal or common. So you might consider something like infant ear piercing, or maybe cosmetic orthodontia, some sort of change to the teeth. In any cultural environment where you make a change to a child's body, it's possible that they may grow up to feel that what happened to them was a diminishment, was something that they don't prefer, in which case I think they have every right to call it a mutilation. But it's possible they may grow up to feel, even as an adaptive preference, that it's something that they like, in which case for me to override their judgment about their own body and say, well, I'm sorry, you're just wrong, this is an undesirable change, to me feels a little bit presumptuous. So my own view is that these kinds of body alterations, from a moral perspective, should be chosen. The role of consent is to distinguish between the morally acceptable body alterations and the ones that are morally unacceptable. So that's a question of right or wrong, but that's a different question from what's the meaning of the words that we're using, or what's the political significance of the words that we're using. And so my view is, if somebody has a change happen to their body that they regard as good, even if they are just forming an adaptive preference for something they cannot change, I don't feel, from my perspective as a bioethicist who's trying to build bridges with people, that it's my position to tell them that actually their body is ugly and damaged and bad. So in my own work, I use the term genital cutting, and I let each person decide for themselves how they feel or how they want to describe their own body. So I'll now take a sip of water and then move on to the next question. So somebody says, following up on this, is it offensive to those who have undergone the procedure, so any form of cutting in this area, to talk about it as genital mutilation, or is it trivializing to those that have been affected negatively if one uses the term circumcision or cutting? This person says, I've heard both men and women who have undergone a genital cutting procedure in their society say that the procedure hasn't negatively affected them, that they live a normal and good life. And even though they weren't part of the decision making because they were children, they still find it offensive to hear themselves described as mutilated. So this just is to support what I said before. Different people feel very differently. Some people feel that it's important to describe what happened to them as mutilation because that's their appraisal of their body, and it also shows something about their moral attitude toward the cutting. And I think that people should be free to describe their own bodies however they like. Other people feel offended by the terminology. And so, again, I use the word cutting because that's neutral and accurate. Everything that I talk about is an instance of genital cutting. And then it's up to the person to decide how they feel about it. What my job is to do is to provide moral reasons for why somebody who may well be happy with their body how it is, nevertheless shouldn't repeat the practice on their own child, because to my mind, that has everything to do with the matter of consent, with the fact that this is a very private and psychosexually significant part of the body in just about every culture. And so regardless of what we call the act of cutting, my arguments have to do with what are the moral reasons for performing or not performing this procedure on a child. Okay, so the next set of questions are really a series of observations or claims that people are making about differences between female and male forms of genital cutting. And the upshot of many of these different comments is that it's misleading and inaccurate and offensive to suggest that there's any kind of comparison between the sorts of procedures that affect girls and the sorts of procedures that affect boys. I'll also just say that these conversations seem to leave out intersex genital cutting, which is not a trivial issue. About 1 in every 2,000 births, we don't have precise statistics, concern a child who's born with genitals that are neither determinately male or female in terms of their visual appearance. And so you sometimes have children that have an organ that's either a small penis or a large clitoris. It's both of those things, or it's either of those things. And so actually figuring out whether to classify the tissue as male or female as the basis upon which you should decide whether it's permissible to cut the tissue turns out to be very complicated because there's no distinct line. And so, if you decide that the tissue is a penis, then you might think, well, it's okay to circumcise it. But if you decide that it's a clitoris, then you might say, well, you shouldn't cut it at all. So it starts to get a little bit messy. But nevertheless, people tend to think in this very binary way where boys are over here and girls are over here. and these things shouldn't be compared. So just here's some comments. One person says, do not equate male circumcision and female genital mutilation. If you're trying to do that, then you're making a cheap polemical point. And what you're really doing is you're doing a huge disservice to the worldwide struggle and fight against FGM. One is a circumcision, the other is a genital mutilation. If you're equating these two things, you're trivializing FGM, and that I cannot believe is anyone's intention. Another person says, FGM is a form of violence against women in the context of discrimination. It is important that this violence be discussed in the context of oppression and control of women. The final comment here, female circumcision must be treated separately. Female genital mutilation is nothing but a serious form of violence against women and girls and a serious violation of human rights. It's a means of controlling the girl, woman, and her entire sexuality, life, and identity. So the upshot of this has been summarized by the host, who says, this sort of view is very common in Finland. What is Earp's opinion on this, and which arguments are there to recommend treating these kinds of procedures either together or separately? So this is indeed a very common view in most Western countries. And it has a very particular history in terms of how this way of framing things came to be the dominant perspective. Prior to the 1970s, this wasn't the main view, because in every society that practices female genital cutting or mutilation, they also practice male genital cutting, but not vice versa. So there are some societies that just cut the genitals of boys, but there are no societies that just cut the genitals of girls. And in most of those societies, the practices are seen as mirror images of each other or as two sides of the same coin. They often serve comparable social functions. So in many African contexts, for example, both practices are done as a rite of passage into adulthood, where boys and girls are equally expected to show courage in the face of pain and discomfort in order to deserve to be considered adults within that society. And so the anthropological view for the longest time was that these were symbolically joined practices. So in the minds of practitioners, they're actually highly related to each other because they're part of a gendered system where, for example, in girls, what's seen as the male part of the female genitalia, so the external clitoris, the part that sticks out like a phallus, by excising this tissue, the masculine androgyny of the child is denied and they're transformed into a fully feminized woman. Whereas for the boy, the foreskin is seen as a feminine appendage that encloses like a womb or a vagina. And so by stripping away the female androgyny of the child, then the boy symbolically is transformed into a fully sexually distinctive man. In something similar to the way that in Western cultures, when we have what we regard as an intersex child who we think is insufficiently sexually differentiated, we too perform sometimes extremely invasive surgeries on the children to try to conform their genitals to what we regard as the appropriate differentiation. So anyway, I won't go through the whole story of how we got from the prevailing view up to the 1970s, which was that these practices are obviously linked and they remain linked in the minds of most practitioners. Because they came about for shared reasons and they serve similar functions socially. But I will just tell you a story to give you a concrete sense of why this general framework is unsustainable and why adhering to this framework is very likely to undermine the legal protections that have been put in place so far for girls. So the anti-FGM laws that exist in various countries are at risk of being struck down, as indeed in the United States just last year, the year before, our federal FGM law was ruled unconstitutional. And it actually has to do with common stereotypes about what people think FGM is and what they think male circumcision is. So one last big picture comment, and then I'll just tell you the story, and it will illustrate why it's important to get more specific than these broad brushed characterizations. The big picture story is that when people think of female genital cutting or mutilation, they almost invariably are thinking of the most extreme forms of such cutting that are concentrated in parts of Northeast Africa. And the versions that are held up in the Western consciousness through media and activism are forms that are done in rural villages with unsterilized equipment and so forth. And so they take that form of female genital cutting and they compare it with something like perhaps male circumcision as it's done in Judaism or in Islam, or as it's done in the United States, let's say in a hospital environment. And so when you compare these two things, these are obviously very different from each other. But what most people don't realize, as I alluded to before, is that in that very same African village, if you want to use that example, I mean, these procedures are also done in hospitals in Egypt, for example, by doctors. But let's just use the stereotype of the rural village and the rusty razor blades. Well, in that same village, the boys are also undergoing circumcision with the same rusty razor blades. And so depending on the community, what's done to the boys or to the girls may be more severe or may involve removing more tissue and poses a greater or lesser risk of an infection, amputation of the organ, death, and so forth. And so if you want to make the comparison, the last thing you should be doing is comparing the most extreme form of female genital cutting in a select area of underdeveloped African community with male circumcision as it's performed in a completely different cultural context in a clinical environment. What you should do is you should compare the rural form of female genital cutting with the rural form of male genital cutting, in which case the overlaps are extremely substantial. And if you want to compare medicalized minor genital cutting, you should look to a country like Malaysia, where the girls have a prick to the clitoral hood performed without removal of tissue, done usually by a doctor in a clinical context. It may be done with pain control and so on. So that starts to look a little bit more like what's done in the United States. So in Malaysia, in some Muslim communities, both boys and girls are, on their view, circumcised. And in that case, what's done to the girls is less severe than what's done to the boys. So you have to compare apples to apples, not apples to oranges. But let me just tell you the story. So in the United States, we recently had a federal court case concerning the first federal test of our anti-FGM law. And it concerned a group of Muslims that are known as the Dawoodi Bohra. And this is a religious sect within the Shia branch of Islam. The Dawoodi Bohra are mostly based in India and Pakistan, but they have immigrated all over the world and have different communities in England and the United States. And this particular case was happening in Detroit, in Michigan. So the form of cutting that was alleged to have happened in this case was what's sometimes called a ritual nick or a prick. So the World Health Organization typology of what they call female genital mutilation refers to more than a dozen different practices that have all been conflated under this one term. And then the most extreme form is the one that people use as the illustration of the entire set of practices. But that's very misleading, because in this particular community, it was a physician trained in the United States who's a member of the Dawoodi Bohra, who allegedly cut, or there's some contestation about whether any tissue was removed, but if there was no evidence of tissue removal. Girls around the age of 7 years old as part of what they regard as a religious requirement. So I'm going to talk about religious significance and so forth, but the point here is that within this particular community, there's a tradition according to which Muhammad's innovation over the old Abrahamic covenant in Judaism, where only the boys are allowed to be circumcised, is that to extend the central covenant of the group to include girls. Girls were also allowed to be circumcised, but it was instructed by Muhammad, and this is recorded in various hadith, which are secondary sources of Islamic jurisprudence, that what should be done to the girls is very minor and should be less severe than what's done to the boys. And so that is, in fact, the current situation among the Dawoodi Bohra. It's also true, as I mentioned, among some Muslim groups in Malaysia and Indonesia, in some other parts of the world that are outside of the African context, which is what most people are thinking about. So this case went up before a judge who could very well see that the ritual pricking of the daughters in this community done by a doctor for religious reasons was less severe than the circumcising of sons done within the very same community. This is a Jewish judge named Bernard Friedman, who had previously ruled over some cases to do with defending male circumcision, and it's undoubted that he connected the dots and could see that if he ruled that this particular action counted as a federal crime and would lead to, more than a decade in prison for the members of the Dawoodi Bohra, this would have some pretty uncomfortable implications for the Equal Protection Clause of the Constitution, which says that people, regardless of their sex and gender and their religion, have to be treated equally before the law. Now, he didn't rule on the basis of equal protection. He made a very clever argument to avoid that topic altogether. And I'll just briefly summarize what he said. He said that this form of ritual nicking of the clitoral hood, which doesn't remove tissue, was already illegal at the level of the individual states because it is a form of criminal assault. So he says the federal government in the United States, because it has a system whereby the national Congress cannot make laws affecting the individual states unless it's under very specific circumstances, like if the practice affects interstate commerce or something like that. He said the federal government didn't have the authority to pass this nationwide law banning FGM because it covers procedures that are even less severe than male circumcision, but those procedures are already illegal as criminal assault. So he avoided dealing with the equal protection issue at the federal level, although he has language in the ruling suggesting that he was aware of that issue. He's passed the issue down to the states, but kind of boxed things into a corner here, because if ritual nicking for explicitly religious reasons constitutes criminal assault, then it's hard to see how a more invasive procedure on boys done but for the same religious reasons within the same group isn't also a criminal assault. So that is now an unresolved issue in American legal jurisprudence. And this is very likely to affect legal interpretations in other countries. In fact, in England in 2015, there was a ruling by Sir James Munby, who is the senior family judge, considering actually a very similar case, a case where what was alleged to have happened was a form of genital mutilation to a girl. They couldn't find any evidence that any cutting had occurred, which doesn't mean it didn't occur, but it means that if it did occur, it would have been sufficiently superficial that any injury healed completely with no visible sign of change. And he said this same family, because she has a brother, will undoubtedly have also performed genital cutting on the brother, which will be, on any view, much more invasive than what is alleged to have happened to the sister. And he says this creates a problem for our law in England because currently we at least act as though the male procedure is tolerable and is permissible. And we don't only say it's permissible when it's done for religious reasons, by the way. We don't require that there be any particular reason. We just say as long as the parents consent to it or give their permission for it to be done, in England, we treat this as a legal procedure. But an emerging view among some legal theorists is that any cutting of a child's body, if it's not a medically necessary surgery that can't be delayed because they can't consent to it, is an assault. That's the definition of assault. So this is where things are now. And what's happening is those who want to defend male circumcision are putting arguments into the literature in bioethics journals, in mainstream law journals, to argue that, in fact, we should tolerate what they regard as minor forms of female genital mutilation, because they have put two and two together. They see that if there's a zero tolerance policy for FGM, including forms that are less severe than male circumcision, and which may indeed be done for explicitly religious reasons, then the next conclusion is that male circumcision would have to be restricted. They don't want that. And then, credit to them for being consistent in their intellectual arguments. They're now actively and robustly arguing in the bioethics and legal journals that what we should do is allow what they think of as minor female genital cutting, including something as severe as cutting the labiaplasty, or procedures which remove part of the clitoral foreskin. Now, my own view is that even a little prick to the clitoral hood is a morally impermissible practice because you're concentrating surgical risk on a particular part of the girl's body that is constructed as private and personal in almost any culture, and certainly in Western societies. So in Western societies, we have the view, and we teach children from a very young age, that adults shouldn't even touch their genitals unless it's somebody in a caretaking relationship and it's medically necessary. So if you're changing diapers or something like that. But if you continued to wash a child's genitals when they were capable of doing that by themselves, everyone would understand that that was impermissible. But of course, any cutting, even a nick, is far more severe than mere touching. And so in a healthcare context, a doctor certainly should not be taking a surgical instrument to a child's healthy genitals, and certainly not as a way of doing some sort of cultural brokerage with the family. That's not the job of the doctor. The doctor's sole commitment is to the health of the child and has to consider whether the patient is able to consent. So this is a vast conversation that's happening among experts in this area that the public remains almost entirely ignorant of, because they're stuck with these stereotypes from the 1970s, where they think what FGM is rural villages and rusty razor blades, and what they think male circumcision is whatever's done in the US in hospitals or maybe in a synagogue in Judaism. And they don't think about it very much more than that. They've also been told since the 1970s that these practices have completely incomparable reasons and motives between them, which is not true from an anthropological perspective, but it's a sort of an article of faith in the Western discourse. And so when people think of comparing what they have imagined in their heads to be completely incomparable practices, it feels very offensive, and they get agitated, and they suggest we shouldn't do it. But my argument is we must compare these practices because they are objectively comparable, and people who know that are making arguments that we should tolerate female circumcision. And so if you want to get ahead of those arguments, which are now gaining steam in the legal literature for the sake of just consistency, which is required by the law, then you're going to have to come up with arguments that are superior to those arguments. And that's what I'm trying to do in my own work, is coming up with an argument saying that all children, regardless of their sexual characteristics, and even intersex children who have genitals that are indeterminate between male and female, all of them deserve to have this special part of their body protected from any surgical risk, because it's rational to prefer that no sharp instrument be taken to that part of your body unless you judge that it's worth the risks, because you endorse the outcome, because you think that on religious or cultural grounds what you're going to benefit from the procedure is worth the risks. So that's a preview of some stuff that we'll get to later. Okay, so there's some questions here which talk about the role of religion, so I guess this is appropriate. Some development and charity organizations that work with FGM prevention claim and point out that the procedure is not being done for religious reasons. Is this correct? And what implications and relevance does this have for FGM prevention and prevention of genital cutting as a whole, irrespective of sex? So I'll take another sip of water and then answer this question. Okay, so this is a very common argument. People will say FGM is not done for religious reasons. They're implicitly trying to draw a contrast with male circumcision, which at least sometimes is done for religious reasons. But it's important to remember that it's often also done for non-religious reasons, and very few people object to that case. And so it seems that this is a little bit of a red herring. But let's just think about the argument. Is the suggestion that if female genital cutting were done for religious reasons, then it would be morally permissible? That seems to be an implication of this view. And yet I think almost everyone who makes this argument doesn't really think that. They think that even if it were done for religious reasons, it would still be impermissible. And so this suggests that this is maybe a disingenuous argument. As we saw in the case of the Dawoodi Bohra, as I was discussing earlier, there are some sects of Islam who do consider both male and female circumcision on their view. In fact, they use a similar Arabic word, khatna, which means circumcision, and it doesn't distinguish between the male and the female forms. So they use the same word to refer to both practices, which they consider to be an egalitarian equation between welcoming the girls into the same religious privilege that the boys have. So if you don't think that that's okay, then you shouldn't be making this false argument that it's not done for religious reasons, because it is in some groups, and presumably don't think it's okay even then. Or maybe you do. We'll have to figure out how we want to talk about this as a society. Another implication of this view seems to be that if a practice is done for merely cultural reasons, then it's more of a bad habit that doesn't deserve any kind of respect. But that doesn't follow either. So a practice might be merely cultural in the sense that it's not literally described in the primary scripture of a religious group. But that's a very Western Protestant way of deciding what counts as a religious practice. The line between religion and culture is very, very vague and blurry. And so if that's how you're defining something being a religious practice, you're already going to be in trouble making a convincing argument. But something, even if it were merely a cultural practice, might be central to the way of life of a group of people and have great symbolic and social significance to them. And so at least prima facie would be worthy of some kind of respect. And by contrast, something might be a literal religious practice and that it's written into a holy book, but still be something that's highly objectionable and should be criticized and might not be worthy of respect. So the mere fact that something is or isn't a religious practice, which is already a tenuous logical distinction, and anthropologically and historically it's tenuous as well, is not determinative as to the level of respect that's owed to the practice, or whether the practice is permissible. But also, again, I don't think anybody really thinks that this is the reason why one practice is permissible and the other isn't, because in the case of male circumcision within Islam, it also is not mentioned in the Quran, which is what people tend to be saying when they refer to female circumcision, quote unquote, not being a religious practice. But no one has any trouble seeing male circumcision as a religious practice, even within Islam, where it isn't mentioned in the primary scripture. And as I said, in the United States, it's predominantly done for clearly cultural reasons, where there's no religious significance for the vast majority of people who do this in the United States. And there are not global human rights campaigns trying to eliminate this non-religious form of male circumcision that's also clearly non-consensual. It's done to babies. So the something being merely cultural is clearly not a reason to oppose it, according to the predominant view. And then finally, female circumcision is mentioned in the Hadith, which are the sayings of Muhammad, a source of secondary Islamic scripture, which is where male circumcision is mentioned. They're mentioned in a similar context, such that at least two of the major schools of jurisprudence within Islam consider both male and female circumcision to be either recommended, in one case obligatory, or at least religiously virtuous, because they have comparable standing in the secondary scripture. And as I say, there's no pope in Islam to say what the one final authoritative interpretation is of these various secondary sources. And so it comes down to the interpretation of each individual religious community. And among the Dawoodi Bohra, among other groups, both male and female genital cutting are explicitly religious practices. So again, for those who think that the reason why FGM is wrong is because it's not religious, and the reason why male circumcision is okay is because for some groups, namely observant Jews, it is religious, then at least to be consistent, they should be contesting all the non-religious forms of male circumcision, which they aren't doing. And they have to figure out what they're going to say about female circumcision when it's explicitly religious, as it is for the group that led to the striking down of the US law. So, okay, that's enough about that. Is there a limit to religious freedom? If one wished to promote the postponement of religious rights like circumcision until adulthood, should that not include all religious rights? Even, for example, the Christian baptism. Is there a difference between religious freedom and freedom of ritual? I think this is framing the debate in a very strange way, because nobody who is arguing about genital autonomy or bodily integrity for children has any interest in limiting religious freedom. There may well be some hardcore atheists or anti-religious people who are interested in criticizing religion as such, but virtually nobody in the mainstream contemporary debate that's arguing for children's bodily integrity is in any way interested in limiting religious freedom. What they're trying to say is that any non-consenting, vulnerable person has a right not to have the most private part of their body surgically altered, regardless of their sex or gender, and regardless of the religious of their parents. So whether somebody wants to baptize their baby is totally irrelevant to that question, which has nothing to do with bodily integrity or genital autonomy. So again, this particular conversation is not about religion. It's about bodily integrity of the most vulnerable members of society, which is recognized as an important ethical concept in just about every other area of law and social policy. Okay, my mouth is drying out, so I'll just repeatedly turn to my water here. One moment. Okay. Circumcision of boys is very common even outside of religious or old traditions, okay, as I mentioned. And it's prevalent in the world, even in some societies with very advanced medical care, like the USA, where the traditions of the families are not indicative of the practice. I'll just say that the United States is literally the only Western developed country that performs circumcision on a majority of boys for non-religious reasons. Israel also circumcises the majority of boys for explicitly religious reasons. So it's actually not the case that circumcision is common in other Western countries. There's a specific history as to why it became common in the United States. And well, actually, I'll be able to get into that by answering this question. So this says, I welcome discussion around circumcision of boys, even in a medical context. In society, however, circumcision of boys does not commonly denote discriminatory purposes, i.e. restricting boys' freedom is not a point of departure. So the main thing to do here is to distinguish between the original purpose or symbolic meaning on behalf of which a practice was introduced into a society, and the subsequent meanings and symbolic justifications that are offered as society's social and moral norms change. So with the case of male circumcision, it's agreed among scholars that the original purpose within Judaism, at least as Moses Maimonides, one of the great interpreters of Jewish law, said, was precisely that it was meant to dull the sexual organ. And the point was that the foreskin is erogenous tissue, it's nervous tissue that's very sensitive to the touch, and it therefore encourages children to want to play with this tissue. And the thought was that this is distracting to keeping their attention on higher and more spiritual matters. And so it was an explicitly anti-sexual practice within basically all of the history of Judaism. And if you talk to Orthodox or very conservative rabbis today, they'll still talk about the important role of male circumcision in dulling the sexual organ. Furthermore, in the United States, this is to go back to why was it introduced in the United States? It was introduced in the late 1800s for various complicated reasons, one main stream of which was to try to combat masturbation. So the very same issue, it's that little children are going to want to touch this part of their body. This tissue is the most sensitive tissue on the penis to light touch. And so by removing this tissue, and also by doing it without anesthesia so that it would be associated with pain, the original point in the United States, or one of the original points, was to have this anti-sexual motive. Now, it's true that it was not discriminatory at the time because they were also advocating anti-masturbation measures for girls, including applying carbolic acid to their clitorises. But that practice fell away. And so what remained actually was just the cutting of the boys. In other words, it is discriminatory in that only boys are subjected still to this practice that had its roots in anti-sexual motives. Now, every generation comes up with a new reason why it does what it does. If you look at female genital cutting, I'll have a chance, I think, to get into some of the deep African history as far as we can unravel it as to why female genital cutting was originally introduced. But what's happened is that societies that recognize that it's not seen as cool anymore to try to limit sexual impulses or to try to diminish the sexual desire, it's not effective in doing this, but insofar as that's the goal, and insofar as that's seen as reprehensible by Western powers that have a lot of influence over the laws and policies of African communities, well, they just come up with new reasons. They say, well, okay, we're not doing it for that reason anymore. We're doing it for health or for hygiene. And so again, according to the World Health Organization, in many communities, a third or more cases of female genital mutilation, cutting, circumcision are done by health professionals. And they'll talk about how there are bacteria that can gather under the hood of the clitoris or among the labia. And so by removing this tissue, you might have health benefits. And they say it's done for aesthetic reasons. And they say it's done because it's equal to what's done to the boys and so forth. So what happens is that as soon as you give a permissible reason for cutting the genitals of a child, then any community that's historically committed to performing this practice just needs to pronounce whatever reason you give them as the acceptable one. And there's no way to fact check them. You can't go inside their head and see whether they're doing it for quote unquote the right reasons. And again, in the United States with circumcision, we don't ask parents what their reasons are for doing it. We don't require that they do it for beneficent reasons. They could do it for malevolent reasons and it would still be permitted. So people, again, have to get their story straight about why they think these practices are wrong. I do not think that the impermissibility of cutting a child's genitals actually turns in any way on the reason the parent or the community has in mind for why it's done. And I'll just illustrate this. Imagine that you have a child who needs a root canal, an emergency root canal, because they have a problem with their teeth and their gums. And so they have to be taken to the dentist for a medically necessary root canal. Now, let's imagine that this child has an evil father who is sadistic and takes pleasure in his child's pain. And the reason why the father is taking the child to the dentist is purely to enjoy the squirming of his child for being subjected to this invasive procedure into his jaw. Well, the sadism of the father gives us very good reason to judge the moral character of the father. So, insofar as the society is promoting genital cutting because of motives that we don't like, because we think that they're doing it on behalf of reasons that we don't accept as tolerable from our cultural perspective, we may have reason to want to judge the motives of the parents. We may want to say, you need to get your cultural systems in order. But it actually has no bearing on the permissibility of the action itself. So in the case of the root canal, it's either permissible to do that or not. And it's not only permissible, it's ethically required to do it because it's medically necessary. The child needs to have this done to preserve their future bodily autonomy. And then the father can have either evil motives or beneficent motives, but either way, the root canal is permissible. So I think that we have to figure out when we're talking about the bad reasons for which we think something is done, and I'll just flag that a lot of this is based on pretty racist and colonial stereotypes about African communities being barbarians who want to control the sexuality of their daughters. That's largely not what's going on. As I mentioned before, male and female genital cutting are done in African societies largely as parallel rites of passage into adulthood, which serve many multifarious social functions. And insofar as there are anti-sexual motives, that's not a way of distinguishing male and female genital cutting, at least in terms of historical reasons that were offered by communities, which are now rapidly changing. Even in the United States, male circumcision was advocated as a way of combating masturbation into something like the 1960s or 70s, and then it wasn't until the sexual revolution when anti-sexual motives became unsupportable that you see this reason suddenly evaporating from the medical literature. But up until that point, that was the prevailing reason that some doctors were giving for why it should be done. Okay, so just to summarize that. If somebody has bad motives for cutting a child's genitals, we should judge their moral character negatively, and we should also judge perhaps the social systems that promote such negative thinking, and try to seek reforms that promote general equality in the society between men and women, let's say. But the reason for which something is done cannot by itself tell us whether the action itself is a rights violation. So I'll dwell on this for one more second. An action has to be a rights violation in the first place for you to then determine whether there's this aggravating factor of it's being done on behalf of objectionable motives. But something can't become a rights violation simply by being done on behalf of objectionable motives. So it's comparable to a hate crime. In order for a mindset of hate to affect how we judge the severity of the punishment that we'll give for a crime, there has to be a crime. And so in this case, the argument is, and this is an argument due to Kai Muller of the London School of Economics. He says, the expressive significance of an action may certainly make us judge negatively the motives of those who are performing the action, but bad motives can't make something a rights violation. It has to be a rights violation in the first place. And his argument is the rights violation is simply the non-consensual cutting, the presumed entitlement of the parents to apply a sharp object to their child's genitals when the child can't consent. But that's a gender-neutral rights violation. That's if you're cutting somebody's genitals without their consent, you can't define the rights violation in terms of what sexual anatomy does the person have. So again, there's a lot of confusion in this area based on these very, very broad stereotypes, some of which, as I suggest, are racist. But what they do is barbaric, and what we do is civilized. That's a very old story. But I think the moral argument is confused. Okay. There are people who claim medical benefits for circumcision regardless of sex. Then there are those who claim medical advantages. Whom should we believe? How do you comment on this from a bioethical perspective? Okay, I'll take another water break and then get into that. The first thing to say is that the main health benefit for which there's any reasonable causal evidence that's been attributed to male circumcision come from studies of consenting adult men in sub-Saharan Africa. And those data are not relevant to and cannot be simply mapped onto non-consensual circumcision, which is the only kind for which there's any meaningful ethical debate. So if you're interested in health benefits, the evidence that we have suggests that you can get those from volunteering to be circumcised as an adult. We don't have evidence that being circumcised as a young child has any meaningful net health benefits that apply to them while they're still unable to consent. I could get into specifics. I mean, there's one exception to that, which is the thought that urinary tract infections are meant to be less common in boys who are circumcised than those who are not. But the problem is that the absolute risk of getting a urinary tract infection for boys is about 10 times less than it is for girls. It's about 1 in 100, regardless of circumcision status. So you would have to perform 100 circumcisions to prevent 1 urinary tract infection, which could be treated with antibiotics, which is the standard of care for girls who get UTIs 10 times more frequently than boys do. So again, this is a total red herring. It's a post hoc justification for why we continue to do a practice that, as I say, originated in anti-sexual motives, but now we have to come up with a sort of civilized, secularly defensible reason for doing it. And so we grasp at straws and appeal to either health benefits that may pertain to adult males in African contexts with heterosexual epidemics of HIV, which does not apply to any Western country, or we talk about urinary tract infections, which is a far worse problem for girls, and nobody would consider removing tissue from the vulva that might harbor a urinary tract infection. Instead, you just treat the infection, which is, of course, what is required by medical ethics. You don't turn to surgery as the first line of defense against a treatable infection. It's only the last line of defense when all other more conservative measures have failed. So just the logic here is removing any part of the body is likely to have some statistical health benefit in the sense that the removed body part can no longer host an infection or be a vector for transmission of disease to other parts of the body. But the question is not, might some statistical health benefits follow from a non-consensual genital surgery, but rather, are these benefits very important? How do they stand in relation to risks and harms? And can they be achieved non-surgically and in a way that respects the autonomy of the person? That is, in a way that does not present the particular risks and harms associated with surgery on this special part of the body, including non-physical emotional harms due to the removal of choice. And the answer to all those questions is obviously there are better ways to achieve health benefits than by preventative surgery. But we can follow the reasoning through. If again, once we say that it's permissible to perform a medically unnecessary genital procedure on a child insofar as their statistical health benefits, then we create an obvious incentive for supporters of what they call female circumcision to perform the same kind of shoddy science that we do to support male circumcision. And they can do that, and they can come up with some, statistical health benefits for certain forms of female genital cutting as well. I'll just use the example of labiaplasty to, again, use a culturally familiar example. This certainly has statistical health benefits in that the labia can host infections, they can become cancerous, they may be injured during sexual activity, and so on. And in some cases, there may be mental health benefits if they allow the woman who chooses this procedure to, feel more comfortable in her body, even if it's on behalf of norms we might want to resist. But none of those facts entails that we should even consider performing neonatal labiaplasty on baby girls, even if it turned out that the surgery is safer or cheaper or has a better healing time at that age. In fact, anyone who even tried to collect data on whether there might be health benefits for neonatal labiaplasty would be committing a federal crime in almost every Western nation, except for the United States, which no longer has a federal anti-FGM law for the reasons I mentioned. But they would be committing criminal assault. And so they wouldn't be allowed to do it, and they certainly wouldn't be allowed to get approval for their experiment from an ethics review board. And why not? Well, they would say, the labia are not just vectors for disease, they're also healthy genital tissue that have nerve endings and serve functions sexually, so including lubricating other parts of the genitals, which is true for the foreskin as well. And any tissue that has value in and of itself should count positive value to a body part. Then simply removing it is a harm, and quite a significant one if it's from the genitals. So that would have to be outweighed by massive health benefits that could not be achieved in any other less invasive way, which is not the case for any health claim for circumcision. Furthermore, this would be a harm whether or not there are additional surgical complications. So even if the risk of surgical complications is low, and I would say low by whose standards? I mean, I should get to decide what risk I'm willing to tolerate on this part of my body in pursuit of which kinds of benefits. So you might think it's low in absolute terms, but I might say, I actually don't want any sharp object taken toward my genitals. So the weight to be assigned to different risks and benefits is a highly individual thing. And my argument is it should be up to the person whose body is going to be affected. The final argument that people would say is that girls, like all children, have a moral right against any non-consensual interference with their sexual anatomy that's not strictly medically necessary. So whether or not there might be health benefits to removing the labia from infant girls is utterly irrelevant to the question of whether it's permissible to do so. All right, another water break. In developmental projects and research projects regarding FGM prevention, the role of men in affecting change is pointed out more often. Might the best way to involve men have to do with including them among those whose bodily integrity and genital autonomy is also protected and promoted? I'm not sure about that. I will say that the suggestion that it's up to men to step up and try to end FGM is a little bit problematic in that it suggests that the women are not capable of deciding to end this practice themselves. This goes back to something I said earlier about the context in which these rituals are performed in virtually every society that performs them, which is that the female genital cutting rite is almost always managed, controlled, perpetuated, and most strongly supported by women. So it's the mothers and the grandmothers who authorize elicit or sometimes carry out the genital cutting of the girls in the very same way that the men control the parallel ceremony for boys. And so you often find that the men in a given society actually do prefer either less invasive forms of female genital cutting because they don't want their sexual partners to be injured, because that's not enjoyable for either of them, or they prefer the complete elimination of the ritual. And you will find that it is the women who, in most cases, most strongly defend the practice. Now, there's various psychological reasons for why that might be, and there's a whole long conversation we could have. But the recent work by the anthropologist Bettina Schell Duncan, who's very carefully studied this issue, suggests that female genital cutting is, in the majority of societies that practice it, what she calls women's business or women's work. Maybe I'll put this in a broader context just because I imagine that that's counterintuitive to many people. There's a general pattern that anthropologists have observed, which is that every society that practices female genital cutting also practices male genital cutting, but not vice versa. So again, within Judaism, within some sects of Islam, but not others, among Americans, only the boys have a genital cutting ritual that they're subjected to, and girls are excluded from what, at least within Judaism, is seen as the most important ritual of the religion. In the African context, then, what's been suggested is that the female rite of passage was introduced in imitation of the pre-existing male ritual, which was widely understood to be a source of power and privilege, whereby boys were transformed into men who could thereby take on the various political and social privileges that adults were entitled to. And girls didn't have a comparable ritual that they could use to transform into women and to have their own process of solidarity by going through an initiation, a rite of passage together. So what many people argue is that the point of these rites of passage or these initiations is that they promote solidarity among the age group of initiates. It's similar to the way of how a hazing ritual works in a fraternity. If you go through a horrible experience and you survive it, you must think to yourself, it must have been worth it to go through that, because then I get to be a part of this great group. And so then you have to internalize that, and then you carry out the practice on the next generation. So the women in many of these societies are under a very similar kind of a logic. There is their own parallel ritual, which men are almost invariably excluded from, often don't know much about, are certainly not allowed to participate in. And the wisdom of the mothers and the grandmothers is handed down from generation to generation. And the age group of girls undergo a initiation that's comparable to what the boys do. And depending on the group, either form of cutting is more or less severe. That depends on the specific situation. And then the thought is that it's promoting solidarity and bonding among them. And so for that reason, they're not going to want to give it up, because again, you have to internalize the thought that that must have been worth it. This is a good thing. It allows me to be a part of the community. It's what bonds me to my sisters. And so it's already the case that men are often, sometimes under pressure from Western authorities, insofar as the men have more political power in the community, is doing things like passing laws that are anti-FGM laws. But these don't cause FGM to go away. It causes it to go underground, where the women continue the practice amongst themselves, but they'll do a less severe form of it so it can't be detected. They'll do it to younger girls so that they can't remember it. So they're starting to do it to little baby girls on the model of US Americans who do it to little baby boys. So it's not even a rite of passage anymore. It's losing its symbolic value, but they're continuing to do it because it's their practice. So the general lesson from this is that there's no way that these global elimination campaigns are going to be successful in causing women to stop promoting female genital cutting within their societies if they continue to badly misunderstand why the practice is done and its history and its the role that it plays within an overall gendered social system. Just as further comment about this, in the West, we have a notion of patriarchy, which is male dominance over women. And we tend to think of society as hierarchically organized in terms of gender, because in many respects, that's what's going on in our cultural history. But starting in the 1970s, when there was an attempt to establish a notion of a global sisterhood where we were all being oppressed in the same way, white Western feminists went into African villages and imposed their notion of a gender hierarchy into societies that are not necessarily organized along those lines. So in many West African cultures, the hierarchy is often more to do with age or seniority to do with status along other dimensions than merely gendered ones. These things are intersectional and interdependent, and lines of power trace along very many different lines. But there was this homogenizing tendency to reduce all of these extremely diverse communities into the same two-dimensional framework that was being used to try to fight important battles in Western politics, to advocate for women's rights in societies that were hierarchically organized along gendered lines. And then there was just bad anthropology happening, where the assumption was this is exactly what must be going on to all women everywhere in every culture, regardless of the specifics. And so you had people like Fran Hoskin, who went into Northeast Africa and was looking at the most severe forms of female genital cutting, and just simply assumed that this must be being done, on behalf of the men who are trying to control the women and so forth. There are some societies that practice female genital cutting that are highly patriarchal, but there's no consistent relationship between the degree of gender inequality in a given society and whether or not it practices genital cutting. For example, some of the most patriarchal societies, like Orthodox Judaism, only cut the genitals of boys, and girls, as I say, are excluded from the privilege of having their genitals cut. So it's not a viable theory, and yet, amazingly, this is what everyone knows about the practice. It's all about trying to control girls' sexuality. I don't think most people know that there's no society that singles out girls for genital cutting, and that the symbolic meanings are multifarious. They change over time. There may be conscious and unconscious reasons for doing it. The reasons why it was done 1,000 years ago may be different to why it's done in a hospital today, and so forth. So again, all that is very, very confused, but there's a major gap between what scholars of these topics have good reason to think about what's going on, and what kind of everybody knows in the general discourse, which is what shapes policy and kind of perpetuates itself by being just the narrative that we have. It's a very comfortable narrative. It's what they do over there is barbaric, and they're horrible people who want to harm and injure and mutilate their daughters. Most people don't realize they're also cutting their sons. Whereas what our culture is invisible because it's the norm, it's the standard. What we do is permissible and acceptable and fine, and we don't want to have to look at our own backyard and consider whether we might be doing something that's a little bit barbaric. And so it's a very comforting thing, and it's couched in a kind of righteous concern for the welfare of little girls, but it's based on theories that are completely untenable if you look at the diversity of genital cutting practices across societies, and if you look at the complex history and the social functions and purposes for which they're done. Okay, another water break. And then I'm getting to the end of the document here. I assume I've been talking for quite some time. Okay, does circumcision violate a right to bodily integrity? An absolute prohibition against all violations of a child's bodily integrity is obviously untenable. Such a prohibition would rule out vaccinations, for example, and other violations of bodily integrity. Okay, so I'll just lean into the disanalogy between vaccines and other forms of infringing on the body envelope of a child. A vaccination does not actually change the external morphology of the body. It does not affect psychosexually significant part of the body of one sex only. It does not remove healthy tissue. And it is the least risky way of promoting a universally recognized good, which must be done in a time-sensitive way to achieve that good. So again, you can just imagine if there were a vaccine that actually required removing genital tissue from one sex only, and it could easily be deferred until the child could choose about their own body parts and so forth. Well, such a vaccine would not be permitted. It would indeed be a violation of the child's right to bodily integrity, and it would be unethical and illegal. So unlike a vaccine, circumcision does permanently change the external morphology of the body. It affects the most psychosexually significant part of one sex only. It does remove healthy tissue. It's not the least risky way of promoting the good, and the good itself is highly contested and depends on a very specific epistemology that's localized to a certain group, which is subject to being reconsidered as the child grows up. So everybody agrees that a medically necessary surgery is something that promotes future bodily autonomy and is all things considered permissible in cases of a medical emergency. That's something that rests on very basic principles that are shared across basically every society. But if you want to say that doing a surgery on a child for cultural benefits or religious benefits, you're again comparing apples to oranges, because in order for me to even view that as a benefit, I have to agree to your metaphysics. Like I have to believe, for example, in the case of Judaism, that there really is a divine covenant that I'm being entered into, or that it really is beneficial to be marked on my genitals in a way that's meant to make me feel connected with my ancestors. And I might have to ignore the fact that why aren't the girls in my society also allowed to take part in this ritual like they've done in some sects of Islam, for example? Isn't that a little bit sexist that they're excluded from the most important rite of the ritual? Those kinds of things are very easy to reconsider, to grow up and go, oh, actually, I'm not so sure I agree with the reason why that was done. Whereas in the case of a medically necessary surgery, no one will grow up to resent that, because that's a universal good that's very stable and robust against reconsideration in just by getting new information or new perspectives. So So more generally, we can say that when it comes to a child's sexual anatomy, there is, in Western ethical legal contexts, a default moral presumption against any non-consensual interference with that part of their body, even by touching. So if you want to talk about a special right to genital integrity or something like that, you can maybe phrase it that way. Okay, just a few more questions here. I'm near the end. The most common justification for the right to bodily integrity is the prohibition against the use of human beings merely as a means for others' ends. Well, that's one way of characterizing the right. However, in the circumcision case, the child's body is not being used as a means for others' ends. Instead, the claim of the parents is that they're circumcising the child for his own benefit. So the claim of any parent who authorizes genital cutting for any child of theirs, including intersex children and girls, is that they're doing it for the benefit of the child. So again, this idea that African parents are trying to mutilate their daughters and cause them harm and actually think that they're causing them net disadvantage is just an insanely racist view. The African parents are authorizing the genital cutting of both their daughters and their sons for comparable reasons, usually as a rite of passage into adulthood, prior to the interference of Western political forces and funding forces, which have then changed the logic of the ritual in a lot of these societies. But it is not the case that, you know, when it comes to their daughters, they're trying to cause them net harm, but when it comes to their son, they're trying to cause them net benefit. Any loving parent who authorizes a genital procedure for their child thinks that they are helping the child. Nevertheless, I'll say that in Judaism, as I understand, the commandment, if you're a devout Jew, falls on the father as a religious obligation. And so the child's body is being used to fulfill a religious obligation that falls on the father. Otherwise, the child could be left to make his own decision about circumcision for his own benefit, as judged by him as to whether it really is a benefit, all things considered. And just to put this in context, more than 50 countries have banned spanking or hitting or slapping a child or any form of corporal punishment, even though in those cases, the parents believe that this is for the benefit of the child. So they say it will teach them discipline. It's for their own good. That's exactly what the parents say. But nevertheless, we've got to a point where we recognize that children are the most vulnerable members of society. They cannot defend their own bodily integrity. And so, as I alluded to before, it's not terribly important what the parents think they're doing the slapping or the hitting or the cutting for. And any kind of genital cutting is far more severe than slapping or hitting or spanking. So if you're a country that's prohibited spanking children for their own good, but you say it's okay to cut off part of their genitals for what the parents think is their own good, again, you're very confused, and you'll have to figure out what your real principle is. Okay, somebody says, what are the people doing who are educated in law? Why are they often silently accepting that children, depending on their gender, have so very different rights to their private parts? Why aren't universal human and children's rights protected and respected? So what I've written here as a response is that the law only considers behaviors that are culturally salient or that seem to be a problem. So if something is common and accepted in a culture, it becomes invisible. And then it's very hard to apply already existing legal or ethical principles to that practice in a consistent way. So a historical example, you can take the case of marital rape. For the longest time, people just didn't apply the basic principles of the wrongness of non-consensual sex to married couples, because it was culturally common and accepted that husbands would just expect sex from their wives, and that was the end of the story. So this is why consciousness raising is really important. What you do often in response to an injustice in the law is you say, listen, everybody, we already agree about this thing in all these other cases. It's just that we're so used to doing whatever this contested practice is that we've failed to extend our own reasoning to that contested case. So let's go ahead and do that. You know, let's count Black people in the United States as full human beings. We already have all our theories right about the rights and privileges that are owed to human beings. Shouldn't we just connect the dots and realize that, you know, our fellow human beings here deserve those same rights and privileges? And, you know, the whole abolitionist movement goes off for that reason. Also, you know, arguments for animal rights go on this way, and arguments against eating meat and so forth. We say, don't we already agree that it's bad to do certain things? And aren't we being inconsistent with ourselves when we continue to treat this particularly vulnerable group in a horrible way? And that's how legal change happens. And I'll say that there is now an upswelling of very distinguished professors of law and legal philosophy, including Reinhard Merkel in Germany, and Stephen Munzer and Gerald Dorkin in the United States, and Kai Moeller in England, who have connected the dots. And they are arguing that all children have the same right to bodily integrity, regardless of their sex or gender. And in fact, this has been the prevailing view among legal scholars who have written on the issue of circumcision going back into the 1990s, starting, I think, with Margaret Somerville in Canada, who was, I think, the first person who said that circumcision, if it's not medically necessary and it's non-consensual, just is a criminal assault and battery. That's what it means to assault someone. And the battery is the application of force. It's just that we don't treat it as such because we're culturally used to it. And as I suggested, the recent ruling according to which the US federal law was struck down confirms this, because the judge said ritual pricking of the clitoral hood for religious reasons, which does not remove tissue and is less severe than male circumcision, is already illegal at the level of the states as a criminal assault and battery. That's what he said. So again, if that's true, the suggestion is that all of these things are already illegal. You don't have to pass a special ban to try to criminalize well-meaning parents for performing a cultural practice on their child's genitals. The argument is that in Western law, it's well established, going back a really long time, that at least at the point where children were recognized not to be property, that you can't just cut their bodies for certain kinds of reasons. There's very narrow conditions under which that's okay, and in which it doesn't count as an assault. Okay, last question. What about human rights groups? Don't we all have a responsibility to know if we're infringing on someone's rights? But even UN organizations pretend not to be aware of the loud and organized complaints of grave human rights violations and threats to public health when it comes to the so-called voluntary medical male circumcision program in African countries. That's an hour-long conversation itself, that there are many human rights abuses happening due to the World Health Organization and US-backed programs for what's supposed to be voluntary medical male circumcision. In many cases, it's not voluntary. I'll just say this quickly. In Kenya, for example, there's evidence that at least 35,000 boys have been circumcised without even the knowledge or consent of their parents, who are as young as 10 years old, by essentially drive-by circumcision vans going around to communities where the local officials are trying to meet their quotas for literally harvesting a certain number of foreskins so that they can get paid. And this is all being paid for by the United States, who hasn't set up proper procedures to make sure that at the very least these things are being done consensually. And so they're just, and again, non-consented surgeries is assault. So that means there's 35,000 boys in Kenya who've been violently assaulted on their genitals, and there is no outcry from the World Health Organization, which is actually promoting and funding this very campaign. I mean, it's a very disturbing situation. So okay, here's my last paragraph. People need to realize that the people who work at the United Nations and the World Health Organization and other places are people. They're human beings with particular cultural backgrounds and biases who see the world through the lens of their own group. And when the group that has the most power, uncontestably, is the United States, then its own particular cultural practices are the ones that will become invisible to the global human rights community. So consider that the vast majority of circumcised women in Africa, or in parts of Southeast Asia, or some parts of the Middle East, regard what happened to them as normal and natural and beautiful and required, in some cases religiously virtuous, just as the majority of circumcised men in the United States view what happened to them as normal and natural and aesthetic and civilized and so forth. So imagine if these African women, these proudly circumcised African women, which is the majority of them in these cultures. Now, again, I support the dissenters in these groups, the ones who are fighting for the rights of girls to have their genitals protected. I think they're on the right side of history. But imagine that these proudly circumcised African women, who are also partaking in a tradition that goes back thousands of years within their group, were the ones who were sitting on the decision-making boards of the United Nations and the World Health Organization, and were directing global policy research, and were deciding what projects got funded or not. Imagine that Africa had colonized Europe and got to decide which practices were the barbaric ones and which ones were the civilized ones. You can imagine there'd be a very different notion of what kinds of things would count as a human rights violation. So I think it is not in any way accidental that the United States, which is the only Western developed nation to continue to practice male circumcision for non-religious reasons, has set a global agenda whereby what the Africans do is barbaric, but male genital cutting is something we shouldn't even talk about, much less compare to it. That story has been told for some 30 years. Among people who work in this area, it's utterly unconvincing. It's obviously farcical. And so there's a very strong upswell now of, dozens and dozens of scholars in law, ethics, anthropology, sociology, and so forth, who are arguing in favor of a child's right, or indeed any non-consenting person's right, to have their genitals protected from any medically unnecessary interference. And I argue that that is the way that this conversation will continue to evolve, and that's ultimately how this should play out over the long arc of history. So, okay, that's my long speaking. I don't know if I can see if there are any questions, maybe, Johan, that you want to ask, or
thank you very much, Brian. Yeah, there are a few questions. Here are two questions that might step outside of the bioethical context a bit, but you may have some thoughts on them anyway. It is about legislation and policy. So first, regardless of gender, what is the strongest argument for and against genital mutilation from a legislative perspective?
Right. So in Western societies that have a strong tradition of individual rights and also a concern for respecting sexual boundaries through the mechanism of consent, it is already agreed that children should be protected from any interference with their genitals that's not medically necessary. There's just this gaping exception and a blind spot that we have for male circumcision and intersex genital cutting when it's not medically necessary, because we think we're fixing the child's genitals. But all you have to do is imagine that male circumcision didn't exist and everything else was the same in our society and in our legal codes and in our medical ethics provisions. And if somebody came along and said, we're going to take a healthy child who has no disease or deformity, and as one of the first experiences of their life, we're going to cut off a third of the functioning skin system of their penis, that person would be seen as crazy. If they tried to do it, they would undoubtedly be arrested for criminal assault and battery of a child. They'd also fall afoul of child abuse statutes. So if nothing changed and all you did was introduce circumcision, it would obviously be child abuse, and it would obviously be already prohibited by the criminal law, so that you wouldn't have to have any legislation. In fact, the FGM law in the United States acknowledged this, because when they passed it in 1996, they said in the legislative materials, this cutting already falls afoul of state level criminal law. So they just were doing an expressive thing where they're saying, we really, really don't like this thing that these African immigrants are doing. And so they passed a special law. But this is the issue. I think people need to understand that it is already illegal to cut a child's genitals unless there's a medical emergency. And that's true of doctors. It's also contrary to doctors' commitments to first do no harm. You can't perform cultural surgeries on children. That's not part of your remit. And so what's happened is circumcision has been grandfathered in because it's familiar to Western culture. But strictly speaking, as far as I understand the latest moves in the legal literature, it is already criminal assault. And what needs to happen is a form of educating and consciousness raising. Now, one group of scholars has suggested that we shouldn't criminally punish parents for, in good faith, authorizing a genital cutting practice for their child if it's for religious reasons or because they can't be expected to know that it's illegal because it's so common. And so there's something you can do where you can create extraordinary exemptions from criminal punishment for parents who meet certain criteria. So if you're an Orthodox Jew in the United States, I agree that you should not be criminally punished. I think that it would just be really bad place to go. But according to this argument, that doesn't actually change the legal status of circumcision. Circumcision is already illegal. And then the question is just, what do you do in terms of educating people about that fact? And any non-religious circumcision should certainly be stopped immediately. I mean, it falls afoul of all these well-accepted legal and ethical principles.
Yeah, and the next one, thank you for that. And the next one is on the same theme about policy. Are there any policy positions that could limit genital cutting without having significant blowback, like more cutting performed by those without medical background?
I think that the main thing that needs to happen at this point in the discourse is just a really honest conversation that's not based on cultural bias, racism, colonialism, and hypocrisy. So right now, the entire discourse is dominated by basically US actors who have a cultural practice that started in their own country for anti-sexual reasons, that was then persisted and became medicalized and created this veneer of civilization painted over the top of it. And then because it became a social norm, it's invisible to people. It doesn't seem like a problem. And so these actors have considerable power in passing policies, in shaping the global research agenda and the global human rights agenda. And what they do then is that they wag their finger at the cultural practices of other groups and contribute to racist stereotypes about these groups as backwards and barbaric without first taking the plank out of their own eye. So I think the first thing that needs to happen is people in positions of power in Western culture need to make sure they have their own house in order by making sure that they have very strict protections for the human rights of children within their own borders before they spend billions of dollars of research money marching into Africa, doing horribly uninformed anthropology, imposing structures of interpretation that are based on Western assumptions onto diverse ethnic groups that are doing genital cutting for all sorts of different reasons, and that are always doing it, if it's done to the girls, also to the boys. Maybe there's a conversation to be had. I think that should be led by local dissenters. I think that people within Africa and Southeast Asia and the Middle East who are trying to fight for something like an autonomy framework, or for the ability of children to consent when they're old enough, if that's what they want to do, I think they should be supported. But what's happened is, starting in the 1970s, the vast majority of this conversation has been led by white Westerners who are from genital cutting cultures, but it's just a form of genital cutting that they're used to. And so they've shaped the policy agenda, they've shaped the research agenda, they've shaped what gets studied and how, and they've shaped what everybody thinks they know in the popular discourse for something like 30 years. But among scholars who specialize in this area, it's already just wildly apparent that the popular view is uninformed, and that it will be unsustainable, and that it's no basis for having protections for children, girls or boys, that will be able to withstand scrutiny.
Thank you, Brian. Here's a question about UN. Have you ever read or reviewed a UN Human Rights Council report? Occasionally, FGM gets attention, but never gets traction outside of good talking points.
Yeah, I do think that there's a lot of talking points. I'm most familiar with the World Health Organization policy on FGM, which has been co-signed within the United Nations. Yes, so I have a very long paper that's, well, 2 long papers that have come out that are kind of point-by-point critiques of the World Health Organization document, and I'll speak about this a little bit. What most people outside of the group of scholars who work on this don't know is that the World Health Organization policy on what they call female genital mutilation is not a scientific document. It's a political document that is entirely funded by anti-FGM activists who are rooted in the 1970s paradigm that was uninformed by post-colonial feminist studies, that are aware of, there's the power asymmetry between men and women is a very real thing that has been importantly contested and needs to continue to be contested within Western societies. But there's another power asymmetry that's forgotten by that kind of analysis, which is the power asymmetry between rich, wealthy democracies of the global north and poor countries of the global south in terms of their bargaining power in international policy and decision making. And so, for the very same reason that if men are the only ones shaping institutions, they're going to end up shaping them in such a way that allows what they do to seem normal and natural and beneficial, and that's going to disadvantage women. That's the original insight of feminist critiques of male-dominated social systems. So too is it the case that if the people driving the global agenda on which practices are horrible and barbaric are white Westerners, then what they do is going to seem normal and natural and acceptable, and it's going to be done in a way that disadvantages and is harmful and is based on double standards for those who don't have equal bargaining power. So the very same feminist insight, which is correct, just needs to be applied in a way that's been informed by the last few decades of research in post-colonial feminist studies that draws attention to that. So the World Health Organization document is full of high school level research errors. It is ethically incoherent. It makes claims about the origins and the nature of female genital cutting that are not true and that are contradicted by vast bodies of anthropological literature. But the problem is that because the World Health Organization also does scientific research and presents itself, for example, it's running the pandemic response, and there's been some concerns about whether there is, political influence from China over their initial response and so forth. So, undoubtedly the WHO is a political body as well, but they have some documents that at least seem to be pretty carefully scientifically assembled by truly the best experts in that area in the most dispassionate way possible. And because of that, when people see their policy on FGM, they assume that it's the same kind of a thing. And so what they do is they just cite it as the authority. And so, you know, almost every research paper and certainly popular materials say, according to the WHO, blah, 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 blah. And that's seen as what you're doing. You're just setting, you know, that's how you start your conversation. And then you do some little research point where you do a derivative point based on the presumptions of the WHO. For example, that they say everywhere female genital mutilation is done, it's a form of discrimination against girls and women, when literally there are no societies that only cut the genitals of girls. And that when it's done, the symbolic meanings and the social purposes and so forth between boys and girls are often highly overlapping. I mean, there's a very long conversation that could be had about that, but basically fundamental claims of the WHO about FGM are false. Another one is that they say certain forms of FGM remove the total clitoris, which is false. The clitoris is a large organ that's mostly underneath the skin that has a small portion protruding out, which is normally part of the glands, sometimes part of the shaft of the clitoris. And so in the most extreme forms of female genital cutting, the ones that most people know about, where they think it removes the clitoris and therefore sexually disables the woman, what's happening is the external portion of the clitoris may be excised in some forms. In some forms, the clitoris is not affected at all. And so it remains the case that there are tissues that make orgasm and sexual pleasure and so forth possible. But then there's this iatrogenic harm, which is that many women come from societies where female genital cutting and male genital cutting are normative. They believe that they're normal and natural and beautiful by their own standards. They move to a Western country and all of a sudden they're told that they're mutilated. And furthermore, they're told that they do not have a clitoris. And so what they think is that it's impossible for them to have an orgasm. And in many cases, that's not true. And so, you know, some colleagues of mine who work at FGM care centers have to go through great lengths to try to reassure the women who are coming to them, who many of them who do have complications and difficulties, that they should feel okay in their bodies, that they have a lot of tissue that can be stimulated, that the vast majority of their clitoris is intact, and so forth. And so they're trying really hard to lobby the World Health Organization to just at least be honest in its anatomy, at least just say, you know, the external clitoris or something like that, just so that the women who are trying to get care don't have to feel like they've been completely sexually maimed, which is the entire narrative assumption of the whole Western discourse. And people don't realize how damaging this is to these immigrant women who are coming in and being told that they're undesirable sexual partners and that there's just, you know, no remaining part of them that could possibly be of any value. So the World Health Organization document is scientifically untenable, ethically incoherent, and actively harmful to the very people that it's trying to promote, because it's based on cliches and stereotypes and anthropologically uninformed generalizations from the 1970s that have not been updated by the last 40 years of research on this topic. And it's a real travesty. So yeah, if people understood that the WHO policy on FGM is an activist political document and has essentially no scientific merit, then people will get a sense of how corrupted the popular discussion is on this topic.
Thank you, Brian. I think we can still take one more question and then some final concluding remarks. This one goes definitely outside of the bioethical context, but maybe you could have some comments on it anyway. Some politicians fear terrorism and or economic and political sanctions if they protect all children equally against circumcision. How should such fears of threats be met?
Well, first of all, there's a question of how is the protection to be pursued? I think what a lot of activists want, both those who advocate for boys and girls and for all children, is they want criminal law to be the main tool that's used to contest these practices. I think if people understood that in communities that practice female genital cutting and male genital cutting, very often these practices are deeply linked to the social identity of the group that serve various complicated social functions and so forth. The idea of just, well, we'll just criminalize the parents, and that's going to be the best way to solve this problem, that's actually very misguided. And my colleague, Sarah Johnsdotter, has done some very important work showing that these zero tolerance criminal law approaches are, again, can be very traumatizing to the communities that are supposed to be helped, including the girls. Because the girls will often go, if there's any suspected cutting, which is often done purely based on racial profiling and no actual evidence that any act has occurred. And in many of these societies, they have stopped doing the procedure once they realize that it's discouraged within the society. these girls will have to undergo forced genital examinations by like police officers looking for evidence of a crime. And, you know, you can imagine being a 12-year-old girl who, you know, in many of these cases likely did not have any form of genital cutting occur to you, depending on how long your community has been in the country. And now having your genitals examined by a police officer looking for evidence. And this itself is an extremely traumatic thing. So I think instead of taking, you know, brown-skinned immigrants and treating them like criminals and then trying to just, you know, protect other people from being treated like criminals that we're more comfortable with, we should stop taking a criminal approach and have a conversation that's, as I say, rooted in honesty, rooted in equal respect between cultures, rooted in trying to actually be informed about the nature of the practice of the other group that you're criticizing, rather than just going on stereotypes from popular discussions, or unfortunately from the World Health Organization document. And then, you know, a lot of the change is going to have to be led from within. If you want to see movement within, for example, Judaism, there's a really active Jewish activist community that is trying to work for reforms. They're probably not going to be very effective within fundamentalist Jewish sects because, you know, as soon as you justify something on the basis of fundamentalist principles, you're essentially immovable by reason. So that's a complicated sociological question. But basically what should be happening is policies that advocate equal respect, honest conversations, that try to understand the actual logic of these various rituals, that try to promote alternatives to them. So for example, within Judaism, there are a number of colleagues and friends of mine who are involved in promoting something called Brit Shalom, which is a baby naming ceremony that can be done to both boys and girls, where you cut a pomegranate and you don't cut the penis of the child or the girl, obviously. And so this is an egalitarian innovation that sort of respects the symbolic significance of the baby naming ceremony, that welcomes boys and girls equally into this covenantal relationship. Now, obviously, it's not going to satisfy religious fundamentalists, but societies always have to deal with what do you do in the case of religious fundamentalists who don't care what your laws say, because they are beholden to a higher power. But for any kind of, you know, liberal or reform movement within Judaism, there are lots of options for how you have alternative rights. And you're also finding that among the most effective ways of getting female genital cutting to stop in the African context is similarly by introducing alternative rights, where once you understand what the point of the ritual is, instead of just saying it's all about mutilating girls, which falls on deaf ears in these societies because they know that's not true. If you instead say, you know, oh, we understand it's part of a rite of passage. Okay, it serves these various social functions. Well, what if you did this other thing and just, you know, didn't actually do any cutting, but instead kept the ceremonies and the celebrations and so forth? Well, a lot of communities are trying that, and that has been one of the most effective ways of getting genital cutting to stop. And it's based on treating the other people like human beings, not like criminals.
Thanks, Brian. We are going to wrap up now. A few comments, ending comments from my part. What you pointed out, what I think many people are not aware of, is the fact that in every context where female genital cutting takes place, so does also male genital cutting, and also in a wider context. You mentioned that the reason why something is done cannot by itself decide its permissibility. That, I think, is an important takeaway. And I should get to decide what is done on my body. It is me or the person who decides, and also the person should be free to describe their body. That was, I think, a very good explanation of the initial questions about which terminology to use. And then my final question to you would be, in the beginning, you mentioned your job. And if you could, as a concluding comment, correct my wording, because I don't remember it correctly, but you said something like this, that your job is to describe why someone who is content with what was done to his or her body should not carry on the procedure to his or her child. How was it that you described your job in all this?
Right. So I don't have the luxury of availing myself of hot rhetoric and stereotype claims about different groups and appealing to just throw everybody in jail. I can't do that because I know too much about these practices. And so what I try to do in my own work is engage in moral conversation with people where I say, here are the reasons why I think it would be a good idea not to circumcise your son or your daughter. And one of the reasons why is that when you perform a permanent genital operation on a child who is growing up in a multicultural society where the significance of that cutting is subject to reconsideration, what you're finding is the more that people just get on the internet and learn about what happened to them in their childhoods, very often you'll have a young girl who was underwent a form of cutting in India, let's say, and then learns about this thing called FGM in school and college, and then goes, well, wait a minute. Oh, I remember something when I was 12 and I went to my aunt's house and some shady stuff happened and I've kind of suppressed that and I wasn't really thinking about it. People don't stay children forever. They grow up, they can get on the internet now, which wasn't true 50 years ago, and they can learn about alternative points of view. And so if you cut somebody's body in a part of the body that in virtually every Western society, and more than that, is considered to be especially private and personal and should only be interacted with under highly intimate circumstances, if you cut their body on behalf of reasons that are easy to reconsider, like the person just has to, not share your religious beliefs, for example, all of a sudden, if you permanently cut a part of my penis, let's say, and you say, well, it's really good because it means you're in a covenant with God, and then I grow up and I become an atheist, well, now I have part of my penis removed on behalf of reasons that I might find highly objectionable. In fact, some of my Jewish friends have told me this story about how, sure, you thought I was going to appreciate this, but you can't undo it, and I don't appreciate it. And every time I have a sexual partner or use a shower or use the toilet, I'm reminded that I have a permanent scar on a part of my body that my society tells me should be my own to make decisions about, that represents my parents' religious beliefs, which I reject. And so to me, this is a very good reason not to perform permanent genital surgery on a child unless it's for a reason that everyone will grow up to accept, namely medical necessity. And so that's what I see my job as, is just try to have a respectful, honest conversation with people that takes into account the complexity of these practices, the range of ways in which they're done, and the range of reasons for which they're done, and says, what is an ethical principle that can accommodate all that complexity without just collapsing into stereotypes that we use to comfort ourselves and pretend that what we do is good and what they do is bad, which is unfortunately where much of the moral conversation has stalled for something like 40 years.
Thank you, Brian. Thank you very much, Brian Earp, from Yale University for this session, this opening session of the week of the Worldwide Day of Genital Autonomy.